Hello and good afternoon, good evening once again. Dr. J here at Ask the Gynecologist, and tonight I'll be talking about chemical pregnancy. Chemical pregnancy. So if you're free, like always, please join me on the screen and let's have a discussion together about chemical pregnancy. The reason why I've chosen this topic today was because one of our clients one of our members asked a question during one of our recent discussion like this about what a chemical pregnancy is. So I've chosen this topic tonight to discuss in detail, if possible, about chemical pregnancy. I know it's already late. Most people are already getting ready to go to bed, so I won't take too much time. I won't steal too much of your time. So if you're free, join me and let's have this discussion tonight about chemical pregnancy. My name is Dr. J at AsktheGynaecologist, and if today is your first time of joining us on this live show, I want to welcome you today. And I want to say, most importantly, you're very special to me, and you're very special to every one of us here at the ATG family. ATG is one of the biggest groups on Facebook where we talk about female gynecological concerns, and we try as much as possible to address them. So if you can hear me clearly, please, or if you're on Facebook, on Instagram, or if you're on YouTube, kindly give me some thumbs up. Let me know you can hear me clearly. And if you can't hear me well for any reason, let me know so I can change my audio or I can change my position. I've tried to enhance our Wi-Fi. Over the last few weeks, I realized that the Wi-Fi system is not very strong in my office here. So we've boosted the signals and we've bought Wi-Fi extenders to ensure that this thing works well. So without much ado, without wasting too much time, I want to go quickly to this topic tonight: chemical pregnancy. Chemical pregnancy. One thing I've realized about we people of the world is that we want to know difficult things, and sometimes we want to know simple things. Chemical pregnancy is a big topic today for our people in diaspora. For our people back home, everybody wants to know what chemical pregnancy is. Everybody wants to know about cryptic pregnancy. Everybody wants to know about fibroid, and everybody wants to know about gender selection and IVF. And we are here to discuss these things. And then people want to know about ovarian cysts as well. So I know these are very, very important topics. I know when we hear these things, we get worried. But my purpose here is to ensure that by the time you've joined ATG and you've spent a month with us, you will have known much about how the body of a woman functions, and you'll be better off in terms of knowledge and also application of the knowledge. There's no use you having knowledge and not knowing how to apply the knowledge. It's always beautiful if you understand something and you know how to use them. The purpose here on ATG is to ensure that we expound on simple things and make simple things easier to understand and easier to digest, and also to explain to other people. Chemical pregnancy, what it is and how do we manage them. Chemical pregnancy itself, is when pregnancy is not yet visible on scan. Pregnancy is not yet visible on scan. You can't see the heartbeat on scan yet, but you've done test of pregnancy and it says positive. You've done your urine pregnancy test, beta HCG, or urine or test of pregnancy, the blood one, serum one, and it says you're pregnant, but yet you can't see pregnancy on scan. I want you to understand this first of all. People ask question, doctor, how early can my pregnancy be visible on scan? People are watching us simultaneously on Instagram and also on Facebook, and we're recording for YouTube packaging and publication. If you're pregnant, the first time you're going to see pregnancy on scan is usually around 6-7 weeks and above. And in fact, around 6-7 weeks, pregnancy will be a tiny blob on scan. It's so tiny, not yet visible, on scan. Usually from about 7 weeks onwards, you start seeing heartbeat, some what we call cardiac pulsation on scan. If the pregnancy is in the womb, it will be intrauterine. If it's not in the womb, it's going to be ectopic pregnancy. And around 6-7 weeks, ectopic pregnancy will usually rupture the tube, because this tube, the fallopian tube, is not designed to hold pregnancy more than 6-7 weeks. It will rupture. So if you've gone for scan, first of all, you've missed your period. By the time you miss your period, okay, so for example, now you're expecting your period today. That's 4 weeks since your last period. You didn't see your period today. Suddenly, tomorrow comes, you see a tiny brown discharge. That could be implantation bleeding. But you don't have to assume brown discharge or pinkish discharge to be implantation bleeding all the time. So you've missed your period, you've done test of pregnancy, it's positive, you went for scan tomorrow, they can't see anything on scan because it's just too early to see anything on scan. Like I told you, usually if you go for scan less than 6 weeks, you're not going to see anything. So if you've missed your period, you've gone to test of pregnancy, it's positive, you're about 4 or 5 weeks pregnant. At that point in time, within that 4 to 6 weeks of pregnancy is chemical pregnancy. Chemical pregnancy because it can only be detected on biochemical test. Biochemical test meaning that we do beta HCG in your urine or beta HCG in your blood. Beta HCG is the test, is the hormone we look for in your urine or blood to confirm and to know whether you're pregnant or not. So if we collect your blood sample, we do serum beta HCG, whether quantitative. If we collect your urine sample, we do beta HCG test on your urine, qualitative. And urine says positive or negative, 1 or 2 lines. Blood says answers in figures. Once your beta HCG in your blood is more than 7, I would say more than 25, it means that you're pregnant. Once we do beta HCG in your blood and we get the result in numbers, beta HCG test, pregnancy test of blood will always give you result in numbers. Once that number is more than 25, it means you're pregnant. Some will say 7, but 25 is a good cutoff. Once it's more than 25, it means you're pregnant. Now, the problem with beta HCG, the problem with urine test of pregnancy, the problem with blood test of pregnancy is that it's going to be positive, whether you've miscarried last week or today, or you're still pregnant. What I'm trying to say is that if a woman is pregnant, you do test of pregnancy, urine or blood, she'll be positive today. If a woman miscarried a week ago, okay, you do urine test of pregnancy, she miscarried a week ago or 2 weeks ago, it will still be positive. If a woman miscarries today and she does the test of pregnancy tomorrow, it will still be positive. That is chemical pregnancy. Chemical pregnancy does not mean you've miscarried. It does not mean you're pregnant. It just means that you've been pregnant at some point in time within the last 1 week. If someone miscarries today, it takes about 2 weeks, 1 to 2 weeks for the blood system, for the kidney to clear out the pregnancy hormone, and then it becomes negative. If someone miscarries today, yesterday, 2-3 days ago, the test of pregnancy will still be positive. It will only become weekly positive. If someone miscarries 2 to 3 days ago, or today or yesterday, or last week, the test of pregnancy in the blood, if it's, for example, it was 1,000 at the beginning of the miscarriage, it will drop to about 850, 600, 200. And the rate of drop is different from people to people. But once the test of pregnancy, the blood test of pregnancy numbers is dropping, it means you're not pregnant. Or it means that you've miscarried, or the person has miscarried, or the pregnancy has stopped growing. If someone miscarries and they pass the pregnancy out today, the test of pregnancy will still be positive tomorrow. It takes about 1 week to 2 weeks for the kidney to clear out the pregnancy hormone. If someone is pregnant and the pregnancy is okay, the pregnancy is in the womb cavity, is developing properly, and you've done a scan, you can't see pregnancy yet because the pregnancy is less than 6-7 weeks, and you do test of pregnancy, it will still be positive, whether in the urine or in the blood. At that point in time, before we discover the pregnancy on scan, we call it chemical pregnancy. Chemical pregnancy is not a disease. Chemical pregnancy is not a stamp of miscarriage. Chemical pregnancy is just a state of the pregnancy until that pregnancy is discoverable on scan. From the moment you do test of pregnancy and it's positive, to the moment the scan can pick up the pregnancy, whether in the womb or outside the womb, is called chemical pregnancy because it's only discoverable biochemically. The thing is that people want to hear big names. Oh, you got chemical pregnancy. Okay, what is the meaning? That is the meaning. There's nothing else to this. Okay, and I've been doing early pregnancy clinics over the last 10 years. Unfortunately, we don't stress ourselves here too much on names, but it's common because of our situation back home. We stress too much on big names. Chemical pregnancy is just as I've said. There's nothing to it. Okay, chemical pregnancy does not mean you've miscarried. Chemical pregnancy does not mean you're going to miscarry, and chemical pregnancy does not make your pregnancy better than the other person. Now, I know that people are going to have questions now. They want to know more about chemical pregnancy. So is there any other thing to know? You see, if you want to, there's nothing else to know. I'll tell you the honest truth. Every other thing you will hear outside this now is just confusion and to confuse you and to ragamuffin you. Okay? That is the honest truth. As I've explained to you, that is what chemical pregnancy is. That is what that is to eat. Okay? So, now, somebody now say, okay, hey, but doctor, I've done scan. They can't see pregnancy. But it's been 12 weeks ago, I saw my last period. Why is this happening? I think I got chemical pregnancy. Let me tell you something. By the time you're 10 weeks pregnant, or 12 weeks pregnant, and we can't see pregnancy in or outside the womb, my sister, you're not pregnant. Or probably you're pregnant and it's miscarried. By the time you are 7 weeks of pregnancy should be visible. Okay? With a good scan, should be visible. Whether outside the womb or inside the womb. If they can't find it, then they should refer you to somebody that can do a proper scan or that has a proper machine so they can know what they are doing. There's no pregnancy hidden. Whatever you do in the light will be exposed in the light. Whatever is done in the dark will be exposed in the light. Pregnancies cannot be hidden. Pregnancy cannot be hidden you can't hide the fire under the bushel forever. It will show, it must light up the world. The pregnancy must show to the world the greatness and the evidence of God present. I've seen people trying to get pregnant all the time. They've done all they need to do, but they are stuck in that belief that they have chemical pregnancy. Chemical pregnancy is nothing but everything I've said now. From the moment you're pregnant, where you've done a test of pregnancy and they say positive, to the moment that this pregnancy is discoverable on scan, during that time interval, usually from week 4 to week 6 or 7, that is chemical pregnancy. Once pregnancy is discoverable on scan, it ceases to be chemical pregnancy. The next thing is that people want to say, okay, what is cryptic pregnancy? Cryptic pregnancy, from the name cryptocurrency, crypti, elographia. Crypto in Latin means hidden. Because something is hidden does not mean it's not there. Okay, are you with me? Because you can't see electricity does not mean it's not there. You touch the wire, it will shock you. Because you can't see hair and you breathe in hair does not mean hair is not there. You try and suck out the hair in this room, whether I will not run out. Because you can't see something does not deny the reality of that thing. Because a pregnancy is not visible on scan, we call it crypto pregnancy. A cryptic pregnancy does not mean it's not there. Now, this number 2 now. Cryptic pregnancy is called cryptic pregnancy up until the time is discoverable. I gave an example about a year ago. I was explaining about cryptic pregnancy. I said I saw a lady, she was about 22 weeks pregnant. Yes, in fact, according to her, she didn't know she was pregnant. Or she now thinks that she's about 10 weeks. When I put the scan on this lady, she came for a 12-week dating scan. I told her, my sister, as I'm scanning you now, this baby's head is about 22 weeks pregnant. She said she never knew she was pregnant. It's possible. People cannot know they are pregnant. It's possible. I've seen many cases like that before. So it's not unusual. It's not like, is she serious? What kind of joke is that? Is she Mary? Is she Saint Mary? No, it's possible. But up until that time is cryptic pregnancy. Once we do scan and we can see the scan and the pregnancy on scan, it ceases to be called cryptic pregnancy. Cryptic pregnancy is not induced. You don't collect some medication to induce cryptic pregnancy in you. Pregnancy is a union of egg and sperm. There's no other way. Whether it's done by IVF, or it's done by doggy style, or it's done by missionary style, as far as the sperm eats the egg, one way or the other, in vivo or in vitro, it is pregnancy. Pregnancy must be united, sperm and egg. I don't care how they united, but they must play match on the stadium of light. That is pregnancy for you. Once pregnancy is there, you don't induce cryptic pregnancy. I've seen people go around to go and collect some stupid steroid injection to induce cryptic pregnancy. I'm not here to tell you the right thing or not to do or not what to do. I'm only here to explain to you the basics and the facts of OBS and Gynae. Now, if you want to go and collect drugs from people, then they should inject you so that you can induce cryptic pregnancy. It's up to you. Your body is your body. But my job is to ensure that I give you the right information. Then you decide what you want to do. I know people already are out now, the cryptic pregnancy army. I know. I'm not fighting you. People can believe what they want to believe, but I'm going to tell you what science is. Nobody induces cryptic pregnancy. No injection, no steroids induces cryptic pregnancy. Pregnancy must result from the union of egg and sperm. I don't know how the egg and sperm will unite to, but they must unite. And they must form one body to become a baby. Whether it's in vitro, in vivo, IUI, IVF, husband and daddy and mommy and daddy, whatever they call it, they on each other, they deposit the action, it becomes a baby. That is how pregnancy is formed. And that is the only way pregnancy is formed, though. Whether in the laboratory, by the putting these two together, but not by inducing some injection. Now, like I said again, if you want to go and collect injection from people, go and do that. By all means, it's up to you. But my job is to tell you that those things are just pure lie to collect your hard-earned money, and please stay with your cash. You've worked too hard to get this money. Don't go and dump it without reason. Now, I'm going to open the floor for questions. I know people are already buzzing with questions right now. I'll take about 10 minutes of questions, quickly dissect them, then we'll log out this evening. So I'm here once again. My name is Dr. Alalade. I'm your one and only favorite doctor here on Ask the Gynaecologist, and with much love today, I want to celebrate the arrival of a baby from one of our moderators, and also celebrate birthday of one of our moderators, Vivian Diko Briggs. You will have seen the Vivian's picture all over ATG timeline today. We are celebrating our moderator's birthday. She's wonderful. She's instrumental to the progress of ATG. And Vivian Diko Briggs, we celebrate you. Everyone celebrates you. We celebrate you here, and everything surrounding, everything alive, everything here, everything on this earth celebrates you today. Today's your day, and many happy returns to you. God bless you. More and greater exploits for you, for yourself, for your home, for your family, by the grace of God. So this floor is open on Instagram for questions. The floor is open on Facebook for questions as well. Let me have your questions. Let's dissect them and let's discuss them. Once again, my name is Dr. Alalade. And if you're not yet registered for the seminar coming up next weekend, not this weekend, the next weekend, we have our female fertility and male fertility boot camp. If you've been trying to get pregnant for years, 6 years, 4 years, 2 years down the line, you've been doing regular sex, you're not able to get pregnant, then you have no reason for not being in this seminar happening this month end, August 31st. You should be in that seminar to learn, to see how you can change the situation. And if you're trying to get pregnant, you've done all your blood tests, nothing's happening, you should attend ATG Fertility Center. Let us do all your infertility tests and let me review all your results. Our ATG Laboratories is only in Lagos for now. We're going to open more branches soon. If God allows, even in more places in Lagos like Suwulega and on the island as well, by God's grace. But first of all, we start where we are. If you got any infertility issues, hysteroscopy to be done, look into your womb cavity, to do all your infertility tests, IVF even inclusive, we at ATG Laboratories are here for you. There's a question here on Instagram. I'm a quiet member. I just want to appreciate you for all your teachings. Thank you so much, Des Lumen. I thank you. God bless you. And thank you, Nifemi Adebola, for joining us here today. We have Lizzie Joffa, Vivian Briggs is here. We have Gloria Wakokoji. We have Lady Grace, Claire Oji. We have Enime Jane. We have Victoria Olongodare Simeon. We have Rema Idoro, Olabisi Bayode, Anosike, Adedayo Taufika Oloko, Flora Wilson, and we have many people online. If I've missed your name, please apologies for that. I'm just trying to scan through quickly. We have Shekem, Inifemi Adebola, Medis team. We have Giz Lumen. We have Rex Shot 4. We have Noble Queen. Noble Queen is saying that how long does it take for pregnancy to show up in the urine? It takes usually within a week to 2. The test of pregnancy now for urine are very, very sensitive. Once your beta HCG in your urine test is your urine sample is more than 25, your test of pregnancy for your urine strip will pick it up. So within a week or 2, the urine test is picked up by the urine strip to know whether you're positive pregnancy or negative. Okay. Enoposi Oju Okeke, thank you so much. Yetunde Adediron is saying, is there anything one can do to keep beta HCG value increasing before the first scan? There's nothing you can do. Beta HCG is produced by the placenta of a normal pregnancy. Okay. So if the pregnancy is okay, the beta HCG will increase normally. If the pregnancy is not doing well, beta HCG is not going to do, it's not going to go up. It's like you asking, what can you do to make your food? And let's find a good example. So basically, that's where it is. When you plant a seed, you have to water it, do the right thing, and it will grow. You have to wait. Beta HCG cannot be forced to increase by any medication in the world. It will increase normally as far as the pregnancy is normal, it's developing, and it's okay, and it's in the womb cavity. Thank you, Blessing Onyike, Abaraklet, Blessing Oluchi, Claire Oji, Bosse Oyewale, thank you so much. And over here we have Noble Queen, UK. She's saying that, I've already answered a question, Noble Queen, on Instagram. Thank you so much, Noble Queen. We have Moshe Bolaton 14, wonderful lady. Moshe Bolaton, thank you so much for being here. She's saying that, doctor, is it possible to have pregnancy symptoms and not get pregnant? It's possible. It's possible. It can be mindset, and it can be the fact that you're taking hormonal medications, maybe for different treatment. It's possible, but it's not very common, though, but it's possible. Thank you, Omawumi Isiak. Thank you so much, Omawumi. God bless you. We have someone saying that, Blessing on UK saying that, can someone be pregnant and the pregnancy test will show negative? It's possible, but it's unlikely. If you're pregnant, and if you're at least 2 weeks pregnant or more, and you are pregnant, there's no way the test will be negative. It's like you scan a woman, you can see the baby on scan, and you've done a test of pregnancy and it's negative. It's not possible, except that pregnancy strip is bad, because there are some fake pregnancy strips. So change it. Doctor, what causes fake pregnancy? Even when blood tests has confirmed the person is pregnant. I don't know what that is. If you're pregnant, you're pregnant. If you don't, let's be honest with ourselves. Let's be simple. If you're pregnant and you've done test of pregnancy, you're pregnant. There's nothing else. And if the pregnancy is in the womb and is developing well, it will be spotted on scan within 6 or 7 weeks of scan. If it's not seen, it can happen. Sometimes with mistakes, sometimes pregnancy is not in the right place, maybe ectopic pregnancy. Usually once you're 12 weeks onward, it will come up. Okay? Worst case scenario, by 20 weeks, it will show up. Okay? That's pregnancy. It can't be hidden. Thank you. Thank you, Adekemi Adeniji. Thank you, Blessing Ike. There's a question here on Instagram, on Nomen 4B. Doctor, getting pregnant immediately after miscarriage before next period, is it safe? There's nothing wrong. As far as you feel comfortable and you feel healed emotionally and physically, and you feel confident and comfortable, and you're well supported, you can get pregnant as soon as you want after miscarriage. There's no hard and fast rule for that. It's all for you to allow your body to heal psychologically, physically. Is it normal to still have discharge, creamy color discharge postpartum? What volume is normal or abnormal? So any discharge you're having, as far as it's not offensive, as far as it's not itchy, as far as it's clear, it's okay. If you're having a creamy color discharge after a delivery, postpartum, if it's more than 6 weeks, you should get a scan. In fact, if it's more than 4 weeks, if it's there, you should get a scan. Get a scan. By that time, 4 weeks postpartum, your bleeding should get very, very light, if not stopped already. But if it's still there, get swabs done to check for infection, get ultrasound scan to check your womb, that your womb is empty. Okay? Can someone be pregnant? Okay, I've seen that question already. What is the cause you don't pregnant and you're not seeing your period? You're not pregnant, you're not seeing your period, that's infertility. We need to do all your hormonal profile to know what's going on. That's the honest truth. What causes miscarriage every 6 weeks of pregnancy? Many things. Chromosomal problems, implantation defects, infections. Okay, that's just a few things that can cause miscarriage in very early pregnancy. Okay, good. Thank you, Silva. Thank you. Let's go back to Instagram. Someone is saying that discharge after adulteration. I don't know what that is. What's Chisom Chigbo? What's your question about discharge after adulteration? What's your question there? So Chisom, what's your question about discharge after adulteration? Now, if you want one-to-one consult with me, please listen attentively. We have a service, premium services, and the different grades depending on your choice. We have the gold service, we have the consult service, which is the monthly or weekly. We have the diamond and the platinum. We also have a WhatsApp, a Telegram group for people that are already pregnant and for people that want to get pregnant that cannot afford the premium services. Now, if you need one-to-one discussion with me, please go through those services. The links are up here. And if you register for any of those services, okay, have in mind that I'm going to ask you for infertility tests. I'm not an herbalist. What I do as a scientist is that I do tests on you, or I tell you to go and do tests at any reputable lab close to you. If you're in Lagos, you're comfortable to come to ATG laboratories, come to our laboratories, we'll do all your infertility tests for you there. We have our own lab license at ATG now. We've just procured a license. It's there. Our labs are fully licensed at ATG. You do all your tests there if you're in Lagos. If you're anywhere outside Lagos, you can do your test anywhere. But if you are a member of our ATG premium services, infertility issues, I will always ask for your hormonal profile, HSG, husband sperm count. If you don't want to supply results to me, there's no need you joining our services, because I will ask you. I'm not a babalawo or mamalawo or badalawo or omalawo. I'm not even a Dr. Lawo. I'm a simple doctor, and I've been doing Gynae for a long time. Now, what I need from you is that once you join our services, I'm going to ask you for basic tests. These tests I'm going to ask you are not big deal tests. They are the basic tests that anybody trying to get pregnant must do, should do, and should supply the results to the doctor, so I can know what is wrong with you and I can know what to fix, what is wrong with you or your husband or both of you. If you're not going to supply a result, or if you don't think you'll be willing to give us your result, then there's no need joining the ATG premium services, because I will not be able to help you. We have so many people subscribe to our services and they are still there, and they've refused blatantly, they've refused intentionally, and they've refused subconsciously to supply their infertility hormonal test result. They don't want to do it, or they are afraid of expenses, or they just think they don't need to do it. If you don't want to do infertility tests, please don't use our premium service, because I will not be able to help you. Now, you don't have to use our laboratory. You can use any laboratory close to you, reputable. That is fine. What you give to me, I will interpret to assess and to give you the advice. Okay, that's just by the way. The question here by Karimot Aileru. I did not menstruate last month. This month I did pregnancy test. Is fatally positive. Please repeat it in a week's time. Okay, Karimot Aileru, repeat your test of pregnancy in a week's time. We have our Instagram handle, is already on the screen. We are broadcasting live as well on Instagram, and people can see us on Instagram, and people are joining us consistently. Every time we are on live, they are seeing us on Instagram now. We've been doing that for a year now. There's a question here on Instagram. Joyfulness 30. Doctor, can someone who does not ovulate get pregnant? Very unlikely. If you're not ovulating, you're unlikely to get pregnant. That's the honest truth. Thank you, Gloria, for putting up the Instagram link and the YouTube link. Thank you so much, Gloria. God bless you for that. God bless you. So now, over here on thank you, guys. Adeliji Kemi is saying that what can also affect pregnancy? Very unlikely. There's a question here that says, what causes offensive discharge from vagina? Likely to be vaginal infection or forgotten tampons in the vagina. Some people do forget their tampons in vagina and they forget it there. On Instagram here, please, moderators, there's a question here on Instagram by Morenike Ade. She's on Instagram. She's asking how she can subscribe to the ATG services. Morenike Ade, please send an email to this email on your screen now. See this email on your screen? Morenike Ade, send an email there. And I'll pick up your email today and I'll answer you as soon as possible. Or one of my secretaries will pick your email tomorrow morning and reply to you. Okay, now, how can we join the premium service? Morenike, yes, so I've given you that email. Forward your email there and just say that, how can I join the premium services, okay? And someone will send you all the link and all the categories of services that we have for the premium services, okay? Chimson is saying that, how long can it take to get pregnant after idotubation? If you have blocked tubes, you've gone for idotubation. Idotubation will only unlock blocked tubes 1 out of every 4. And if your tubes have been unblocked and it's been opened through idotubation, if you're lucky, good for you. You can start to try for pregnancy as soon as possible when you feel comfortable. Happiness Okeke is asking, what can you do to boost low progesterone after hormonal ISA? We can use Dufastone. There's a way we use Dufastone sequentially to boost your progesterone. If you want to know that, join me on the premium services and I'll give you the advice for that, okay? Doctor, what causes brown discharge? Brown discharge can happen from infection. Brown discharge can happen after sex. Brown discharge can happen from cervical erosion. Brown discharge can happen from yeast infection. Brown discharge can happen from abnormal cervical smear. Brown discharge can happen from a miscarriage, and so on and so forth. There are so many things that can cause brown discharge. The first things first is for you to be examined We examine your vagina, look at your cervix, and also take swabs from your vagina and do tests of pregnancy to know what is causing your brown discharge, and then we can take it from there. Brown discharge in pregnancy is likely to be bleeding from baby or bleeding from your cervix. We need to know which one is bleeding. Is it your cervix, which is you, or baby? And if it's baby, it can increase the risk of miscarriage, okay? And Chidima, thank you so much. Boss of you always saying that, please, sir, is there something that has been, there's someone that has been married for 16 years. Who is someone? Someone is a human being now. This person married for 16 years. She's trying to get pregnant. If she's trying to get pregnant, give her the ATG services link and let her subscribe to her services, and I'll consult with her. I can't consult you for her, or I can't consult her for you. Whichever way, I don't know. I can't consult third party. You see, you cannot shave somebody's head in their absence. Bring her to the barber shop. Let us see what we can do by the grace of God only. Okay? Now, thank you guys. Cream Layers on Instagram. Now, over here, I can see Anne has already put up the link for the premium services and the gold services. If you need any of the services, join. These services have different categories. We have the weekly services with the monthly, the gold, diamond, the platinum, and all that. Okay. Thank you so much, Asa Young, for joining today. Asa Young, you were here last time. God bless you. God, thank you so much for that link. I can see you. There's a question here by Moses Abu. Doctor, for someone who want to go for IVF, how will she go about it? Moses Abu, if you want to go for IVF at ATG Center, just send an email to our email, and my secretary will reach out to you tomorrow morning, and she'll give you all the details as well, and she might even give you the number to call, and we can talk about these things, okay? So call, Moses Abu, send an email to that link, to that email address, and someone will get back to you today or tomorrow morning, okay? Gift Fubara is saying, you had sex on 23rd of February, tested positive on the 9th of March, urine test, blood test, you did scan 23rd of March, nothing was seen, because nothing will be seen, it's too early. Okay? Then you did another scan on 28th of March, something like that, nothing happened. Okay, the question is gone. I wish I could have read that question completely, because I'm not that a fast reader. So I couldn't see that question completely. Basically, I think if you had a missed abortion or missed miscarriage, you should get evacuation done. And the good thing is that you're able to get pregnant yourself. So getting pregnant again is going to be better for you and much easier. And you might not even need any sort of support at all to get pregnant, okay? I mean, IVF wise. Doctor, they said that fibroid 10 centimeter is possible to get pregnant. If your fibroid is more than 5 cm, if your fibroid is more than 5 cm, please, I beg in the name of God, just take it out. Just go and take it out. If you've been trying to get pregnant for all these years and your fibroid is more than 5 centimeter, just think of getting it out. Okay, especially if the fibroid is in the womb cavity. Okay, I'm just giving the basic idea. Okay, I'm giving a random summary idea. Okay, but there are more details to this though. But that's just a summary idea for the simple-minded. Chidera was saying that Gift Fubara, your question again is back. Why didn't the previous scan about 6 weeks pregnancy? You did it. Okay, I don't know why they didn't see the pregnancy. Probably it was a poor scan machine, or probably it was poor skills by the person doing the scan. Usually 6 week scan, they should see pregnancy. But if the pregnancy has already miscarried and you go for a 6 week scan, and maybe the pregnancy stopped going at 4 weeks, you probably not see anything on 6 weeks though. So maybe that's what happened. I don't know. We need to go through the history fully. But if you had a scan done at 6 weeks and the pregnancy was okay at 6 weeks, we should see it on scan. As far as the scan is good transducer, good probe, good skills for the person scanning, they will pick up scan. What is cryptic pregnancy? Ifi, Igbo, Abuchi, watch the show from beginning. I already explained cryptic pregnancy in detail. Okay, I can't go over it again like this. So this same video, I talked about cryptic pregnancy. Watch it again. Toke on Instagram, she's asking what is chemical pregnancy. The whole show of today is about chemical pregnancy. I already discussed it. Definitely, you came to the program, to the show a bit late. You can watch the discussion from beginning again on this show once this show ends. Okay. Somebody says they need the ATG email address. Please, can somebody help me give Lydia Agege ATG email address, please? Thank you guys. Okay, I'll see you soon. and see you probably tomorrow by God's grace, all things being equal. Once again, I want to say I love you all so much, and I really cherish you all, and thank you for spending your time to listen to me, spending your data, which is expensive, to listen to me. I appreciate you, I love you, and I love you so much. And when I say so, trust me, I say it from the bottom of my heart, sincerely speaking, and I love myself too. See you soon. Bye-bye.